In terms of the testing, 100,000 a day would be very welcome. How are we going to get to that point where it does seem we have been pretty slow at this point?
Well, we've hit the targets that we set at the start in terms of testing, but we clearly need to ramp up the amount of testing. So yesterday I set the goal of 100,000 tests a day by the end of this month. And we have a plan with 5 pillars to deliver on those. In the first instance, the tests that are being done by Public Health England and within the NHS, those tests, which are the bulk of the tests at the moment, they need to expand. But more than that, we need to bring companies, private organisations, the universities, all to bring their testing capabilities to bear on this. You know, Britain didn't go into this crisis with a big testing industry, a big diagnostics industry. But we have got a world-beating pharmaceutical industry, companies like AstraZeneca, GlaxoSmithKline. And so they're going to turn some of their industrial might to this question of testing, and we're going to be working with the existing testing companies to really ramp up their efforts. It's a big task, it's a big ask, but you know, we're opening the NHS Nightingale today. We managed to build that in 9 days. On ventilators, we asked companies that haven't ever made a ventilator before to step up to the plate, and they're delivering ventilators, and now we need to do the same on testing.
Yeah, and look, I don't want to sound overly negative because I know a lot of people are putting in an awful lot of work at the moment, and obviously people are trying their best. But you say it's a big ask and a big task. Well, people are offering to help out. We spoke yesterday to a director for iGenomics, an accredited fertility testing centre. They say they can handle 800 swabs a day. They have apparently been trying to get hold of you or people in your team for 3 weeks and still haven't had a response. Why is it that there's a number of cases, I've heard something similar from ventilator companies, why is it that people are struggling to get through to offer services that they're willing to give?
Well, clearly, with the existing programme, we've been using the big labs, but this is a national effort and everyone's got a part to play. And if those tests work, and it's really important that they work, because I've also had lots of offers of people from tests where when we've gone into the details of it, the test hasn't worked. It is a complicated piece of biochemistry, one of these tests. So long as they work, then we want to work with them. So I'm expanding my team on this all of the time, and all of those companies, all of the labs that can play a part in this national effort, then we want them to.
Why is it, though, that we do seem to be behind other countries in the state of testing? I know people talk about Germany a lot. I know they've got, in some respects, better resources when it comes to this sort of area. I know there's issues with reagents, but the WHO said test, test and test, and yet Jenny Harris, the Deputy Chief Medical Officer, said that advice at the time didn't apply to us. Have we changed our position on that? Have we been a bit confused?
No, the reason that comment was aimed at others is because we've been ramping up our testing all the time. A month ago, we only had the capacity to test 2,000 people a day. It's now 10,000. But as you know, I've set the goal nationally of hitting 100,000 by the end of the month. Now, it's true that some other countries like Germany went into this crisis with a very big diagnostics industry. Germany has over 100 labs that were ready to go, if you like. We started with some of the best scientific labs in the world, particularly Porton Down, a very famous world-class lab, also Colindale, some of the university labs, but not the sort of scale that Germany had. If you look at other similar countries that started in the same sort of place, like France, we've tested far more people than in France. So if you look internationally, there are examples where they started in a stronger place. There's examples where, like us, they've been having to build up from a much smaller base. All that matters to me is getting this right and getting the British national effort on testing up to up to the scale it needs to be, in the same way that we're expanding the NHS and making sure that there's always the ventilator capacity that people need for this very specific illness. So, you know, we of course we look internationally to learn from what we can from abroad, but all that really matters is delivering for the nation and the whole country coming together to try to solve this great problem of coronavirus.
One of the big problems, of course, is to do with staffing in the NHS at the moment. And hopefully testing will obviously eliminate some of those issues, we know. When it comes to frontline staff, we've had some high-profile cases of people who have sadly died as a result of this. Where are we in terms of frontline staff who are critically ill?
Well, it's true that the testing for frontline staff is a really important part of what we need testing for. As of yesterday morning, 5,000 frontline staff had been tested. It's also important that we have tests for the families of critical staff so that they don't have to isolate if one of their family becomes ill, so that they can get to work. And as of yesterday, that's being rolled out too. Forgive
me for interrupting, but where are we on the numbers here? Because actually, the numbers are critical. You must be aware of the numbers because of the direct impact it's having on frontline services.
Yes, exactly. I was just about to come on to that. So, the number of doctors who are off is 5.7%. So it's just you know, we want to get that number down, but it's much smaller than some of the numbers that have been bandied about. And in the main, the vast majority of people in the NHS are doing their duty and going into work. And, you know, speaking directly to them, I know how hard this is within the NHS. And I think they've done an absolutely amazing job of stepping up to the plate and doing their duty, and the vocation to care for people, I think, is just incredibly inspiring to us all.
Yeah, well, look, there's no question, is there, about that, and we saw that reflected in the applause again last night. But look, the Royal College of Physicians is saying a quarter of its doctors are off sick. The Royal College of Nurses are reporting a high number too. I mean, that would seem to be higher than your 5.7%.
Yes, those figures are wrong. And that's why we released the figures of the 5.7% of doctors. It's just under 8% of all staff, and which is a much more reassuring picture, and because that's the accurate picture. But of course, I want to get those figures down, which is why this staff testing is important too.
Where are we in PPE, personal protection equipment? Because obviously there are concerns that there isn't enough of that by a long way in the NHS at the moment, and obviously some of these infections could have been caused by that. Where are we in terms of the supply chain for PPE?
Well, on PPE, we do have large stocks that we had in place in case something like this happens. The challenge is getting the right PPE to every single person right across, not just the NHS like you mentioned, but also social care and then some of the other critical services like prisons. So that delivery of the PPE is a tough logistical exercise. We brought the Army in to manage it, and they've been absolutely brilliant. I'm working on it incredibly hard to try to make sure we get PPE to everybody, because, you know, I understand we're asking people to put themselves in harm's way, and we've got to make sure they've got the right equipment. Now, the number of people who have are complaining to our hotline and saying we haven't got the PPE, that number is falling, which is good news. But we need to make sure that we get PPE to everybody, the right PPE for them to use for the work that they're doing.
Look, I know you've got a lot on this morning. Just two more questions, if I may, before you have to go. Can we talk about lockdown and isolation? And obviously, we're struggling to get a precise figure on when things might start to change. That's understandable. But have you got a strategy in place as to how we end a lockdown? Because it's going to have to be phased out and something to do with the antibody test as well, isn't it?
Yes. The first step is to get the rate of infection down so that isn't increasing. And as you say, it takes some time after the lockdown's put in place to get that rate of infection that's being the rate of transmission down. That's the first step. Then we need to make sure that we have the testing in place and the tracking, so that people, we don't. If we release any of the measures, we don't simply then have the infection spread again in the way that it was starting to spread when we brought the measures into place. So it is a very difficult thing. In the meantime, we've got to give that economic support to people, especially to businesses, to keep jobs open. And on that, I think that the Chancellor, Rishi Sunak, has been doing an unbelievably good job in giving all the support that we possibly can. And he's been lauded around the world for the quality of the measures that he's brought in and for the comprehensive nature of the economic response. This is a really tough time on the economic front, really unprecedented. But there is nobody who's been doing a better job than the Chancellor of the Exchequer, Rishi Sunak, in making that happen.
Look, you've had COVID-19. You're looking pretty well after your period of isolation. The Prime Minister's been releasing videos. It's got to be said, he's looking pretty rough. He's clearly not been faring as well as you have under all of this.
Well, I think he got it a little bit after me, in my case, it is rough, especially when you're on the downhill part of it. It's very worrying because we've all seen how serious it can get. I had a couple of days when it was really very unpleasant, and I've lost about half a stone. But thankfully, I've then recovered, and I'm now feeling fine, and it's very good to be back at work. I've talked to the Prime Minister all the way through this. He's working very hard as much as he can from home, obviously, in Downing Street. But I've worked with him every day all the way through, and he's doing what's needed and taking the decisions. But we all wish him a very speedy recovery.
Well, Secretary of State, we appreciate your time this morning. Thank you very much indeed.